And now we can move to our last part of presentation with neurofeedback training. And I will ask Tatiana to make us a short description of this method. Tatiana?
So our last part of the webinar is dedicated to biofeedback. It is the last but not least. Biofeedback is technique that enables an individual to learn how to change their physiological parameters. So during biofeedback, the person can change the physiological parameters. That kind of parameters he can change. It could be the amplitude of EEG or power spectrum of EEG, amplitude of a milligram, heart rate, breathing rate, and others. So the clinical study shows that the biofeedback alone or in combination with other behavior method is effective method for treatment of different medical and psychological disorders such as headache, attention deficit hyperactivity disorders, anxiety, learning disability, and substance abuse and others. So, as I said, the children with attention deficit hyperactivity disorders, children with ADHD, they are the candidate for biofeedback. And the electroencephalography of these children is characterized by excessive fat rhythm in frontal region. So the question arises: if they can normalize the EEG of this person, it will help to normalize the state of health. So, does biofeedback can reduce the hyperactivity of patients with ADHD? Does biofeedback can improve the attention of these children? And clinical study shows that biofeedback can be a very effective method for this patient. But how we can explain children to change his EEG? It's impossible because it's unclear for them. But if we ask patient to increase their music volume, or we ask them to make fish move, it would be clear for me. It's not very easy, but it's clear. But our software, neural spectrum software, can create their template. The fish movements depends on the EEG of this person. So, if the patient with ADHD reduce their third rhythm in frontal region, the fish swim and the music becomes louder. So, in the basis of biofeedback is the visualization of physiological parameters, and we can create this visualization with help of some movement, films, photos, and with music, with game, and something like that. So the biofeedback training is performed in accordance with the protocols. Protocols is a design of biofeedback treatment. The protocols determine the physiological parameters which we'd like to change, and protocols determine the number of electrodes which we should apply. The protocols determine the number of trainings which is needed for effective therapy. And Neurosoft recommended to use protocols which efficacy was clinically proved. So the biofeedback therapy consists of several steps. The first steps is a pre-training assessment of psychological parameters. So in case with a child with ADHD, we should assess parameters of the attention with help of some psychological techniques or questionnaires and something. So we can perform the conversation with child's parents and their teachers to assess their behavior. The next step, it is the pre-assessment, pre-training assessment of physiological parameters which we'd like to change. So for patients with ADHD, we should to perform EEG recording and to assess the theta rhythm. So it would be pre-training assessment. The main part of the biofeedback therapy is biofeedback training, of course, and in case with and if the EEG is physiological parameters which we need to change, we can call this technique neurofeedback. The neurofeedback or biofeedback consists of several biofeedback trainings, and the number of the training may be 30, 40. And we can perform this training one a week, maybe twice a week, in accordance with the protocols. And of course, at the beginning of our therapy, we should to learn patient to change his physiological parameters. When the biofeedback therapy is finished, we perform the post-training assessment of physiological parameters and the psychological parameters. So for patients with ADHD, we should perform the calculation of parameters of attention, and we should perform EEG to calculate the power spectrum of theta rate. And we should compare the pre-training parameters and the post-training parameters. And it's very important to assess the efficacy of biofeedback therapy. And so I think Alexey is going to show you a biofeedback training which we can perform with help of neuron spectrum software.
Yeah, thank you, Tatiana. We will use the same device and the same patient for neurofeedback training. I'll start new examination with help of my special template of exam, neurofeedback. Put patient data as usual. And you can see that now I have a work table for neurofeedback. I can see here the window for the patient and the window for the doctor. Usually for neurofeedback training, we use dual screen mode. We use two displays, one for the doctor and another for the patient. But today for demonstration via Zoom, we can use only one screen. Because our patient can see the screen behind him. So what we can see in this window, EEG traces area, not only EEG, we can use for neurofeedback EEG, ECG, respiration traces, SpO2 level, temperature, EMG, amplitude, and other signals. Also, we can see here neurofeedback training successfulness trend, and the neurofeedback manager for the doctor, where we can select neurofeedback template. For example, we can choose alpha training for attention deficit and hyperactivity disorder, as Tatiana said. We can select the neurofeedback template, which contains one, as here, or several different conditions. According to these conditions, software will calculate the training successfulness and will show the feedback according to this successfulness to the patient. Now let's try to start our training and we'll see how it works. By the way, I can switch on or switch off the patient window. For example, before training, I can assume the current activity of EEG of this patient without neurofeedback. For example, here, now I can see the current parameters value. It means that alpha rhythm for this patient now alpha rhythm index for this patient now is 10, about 10, and it is quite good for this diapason, which can be adjustable. For example, it is 11, and the successfulness is quite good for now. And when we see that it is quite easy for this patient, we can start learning and show the patient window. Here, the task for our patient is to move octopus as higher as better. So if the successfulness of the training is 100%, for example, I can show it for my patient here. Now patient can see the successfulness. If it is a child, you can make it with some bar without digits like this. But we have adult patient here. And when we understand, for example, that this condition is quite easy for our patient now, we can change the condition of training, and you can see that results of successfulness is lower now. We can increase, and you can see that current parameter of alpha rhythm index is quite similar. It is the same, but the successfulness is lower because we changed the diapason of this training. Also, we can add another condition. For example, also we can choose EEG rhythm index level, but we can select, for example, beta rhythm, or we can, for example, select some custom diapason, for example, from 13 up to 25 Hertz, and we can set up the index diapason. For example, we want to make this index more than 10%, for example, like this. And we can see also the current value of this rhythm, of this custom range, and the current successfulness. It is 100% now, because it is a very easy task for this patient. We can switch off this condition, and it will not take part in calculation of common successfulness. If we switch it on, now the result successfulness is the arithmetic averaged number of these two conditions successfulness. We can add more conditions here. For example, we can add EEG rhythm indexes ratio, not only level, but ratio between different indexes. We can add head rate condition. For example, we have ECG channel here, and we have some head rate frequency. It's quite high, and we can put additional condition here. You can see that now it is inside this diapason. Now it is out of this diapason, and the successfulness is not 100. So this condition will help the patient to sit still, relax, and so on, to make the head rate lower, to include it in this diapason. You can make it more difficult for this patient, for example, like this, and so on. Also, we have a lot of different predefined templates. For example, relax training. Disconnect my device, sorry. Relax training, which contains three condition. I switch off the last one because we have no respiration channel here in our montage today. We have alpha rhythm condition and ECG. It means a heart rate condition. Also, we have a lot of predefined feedback types, different games. For example, some racings where the speed of the car is depend on successfulness of our training. We can use, for example, some slideshow with some family pictures, for example, which are interesting for our patient. We can put here some audio files to make some sound feedback. Also, we can select some video film and other video content for our patient, and so on. A lot of different kind of feedbacks. So after training, we can stop the procedure and can check the trend of successfulness. And if we will move through the traces, we will also see the current successfulness in the trend window, and we also will see the current conditions for training and even current values for diapasons for each condition. For example, I'll show you here we change. You can see here we changed our diapason for our patient, and a few minutes ago we changed the number of conditions, and then we changed the whole, we add the ECG condition, and then we changed the template here. All these actions were saved in this examination as a history, and most of all, you can compare one examination with another, next examination, to understand the dynamic of this patient. For example, if we need to decrease or increase the alpha rhythm index, you can compare one examination with another to understand if your patient's going in a correct direction, in right direction. So as usual, at the end, we will prepare a report template where we can get all this information like this. And we also can put some phrases from glossary and put some traces, for example, if it is interesting for this examination. I think it is all I wanted to show you about neurofeedback.